Hello, everyone. It's Monday, April the 25th. I've got great news from the standpoint, even though it's over the weekend, we've had one additional death that I've got to report to you. That was the 6,824th death. It's a 61-year-old male from Kanawha County, and we hate like crazy to have lost this one gentleman from Kanawha County. But really and truly, we're really, really delighted that the total number of deaths we've seen have gone down and down. You know, I think we have 3 counties today that are yellow and all the rest green, and I'll get to that in just one second. But again, keep this gentleman in your prayers. As for all those, 6,824 now that we've lost. But please just know that as we've all continued to pull the rope together, we're getting there. It's been tough. It's been really, really, really tough. But it doesn't get any tougher than it is on this family right now. This family, this 61-year-old man in Kanawha County. So please, please, please keep them in your prayers. 631 active cases today in West Virginia, 432 new positive cases. The daily positivity rate is at 4.45. That means we didn't test hardly any. Our cumulative number continues to fall. It's at 8.12. We're a little over, almost 493,000 people have recovered from this dreaded killer. We have 87 people hospitalized, 23 in the ICU units and 12 on ventilators. And like I said before, we have only three yellow counties and all the rest green. I remind you over and over and over about your booster shots. And if I could just take just 1 second, please listen to me on these booster shots. You've got to get that done. I mean, I know the weather's getting better and the sun's shining and we're only reporting 1 death, and I know all that. But there is no way that this thing is gone, just flat gone. You do not need to be on this list. If you're 50 and older, you've got to get that booster shot. The 4 shots is available to you right now, and absolutely take advantage. Please take advantage and get that shot. From the vaccine numbers on our update, we're at 90.6% of the 65 and olders. You know, it's like I said, it's been slow go, but nevertheless, we've continued to make improvement, and I'm happy for that. On the new vaccine calculator and everything, that's West Virginia and Dr. Marsh and, you know, General Hoyer, and I don't know who all else played a role in it and everything, but it's there for you. It will help you as far as knowing when your next vaccination is due. I've mentioned over and over about the second booster that is now available to you. If you're 50 and older, please take advantage, please. From the standpoint of our COVID-19 vaccine info line, all the information is up on our website. The same is true for our free testing. We have 25 outbreaks right now in our long-term care facilities, none in our church community, 12 inmate cases and 1 staff case. From the standpoint of our rental assistance program, it's still available to renters and landlords. Landlords have to come with permission, but nevertheless, there's a great deal of monies out there that we're going to leave on the table. And if you're hurting and you have a situation to where you got behind as a renter and everything, whatever it may be, please call us and see if we can get you qualified for these dollars. It'll really help you. From the standpoint of our homeowner assistance program, same thing. Please call us. You know, there's a real chance we can get you qualified, and if it is, it's just going to put some dollars in your pocket, which will put dollars in West Virginia, and with the multiplier effect of those dollars, it'll really be meaningful. I tell you over and over about giving blood. I don't want you to just hear my words and brush them off. There's people out there that need you really badly right now. And if you've been blessed enough to recover from this dreaded killer and everything, please check with your physician and see if there's a chance, you know, that you could go ahead and give blood. I want to talk to you just a second about our Jump Start program and everything. We copied it from the folks out in Oklahoma. and it's been very, very successful, and it's surely nothing close to anything that we did in the beginning. Is from an incentive standpoint, it's $1,500 for people that we can get back into the workforce and everything, get them qualified and get them a job. And get them a job that they stay on at that job at least 8 weeks. But we feel like if we can keep them for 8 weeks, we'll keep them, period. I've told you over and over about going through the drive-through window and talking to those two ladies. They're so proud of themselves. I loved it. I loved it to death. You know, so good work for those folks and everything working on the Jobs Jumpstart program. On Friday, I called a special session of the West Virginia Legislature. They met today at noon. I placed 16 bills on the call. A lot of this was cleanup, you know, from the bills that they just couldn't get to and they ran out of time on and everything. And but one of the additional bills that we put on there was the infrastructure matching fund. This is really, really important. We're going to put 200, if we can get the legislature's blessings, you know, I'm asking them for $250 million to be placed in this fund to provide matching grants to municipalities for use in upgrading infrastructure such as water and sewers projects. You know, when it really boils right down to it, these are major dollars, and they are badly, badly needed. It'll help make life better for all West Virginians, especially our cities and you know, and all folks across West Virginia. You know, we still have so many places where these utilities are just not available. That's all there is to it. And we have so many people that are in real need. And so I really hope and pray in every way that the legislature will come right with me on this one and we'll get this done. It's a huge step forward. And I'm going to read this last thing. These funds will allow us to improve water and wastewater systems in communities across the state, providing more reliable and efficient utilities where they are needed the most. I don't know how it could be any better than that. I'm going to read it one more time. These funds will allow us to improve water and wastewater systems in communities across the state, providing more reliable and efficient utilities where they are needed the most. You know, I don't know how it gets any better than that. We're doing a lot of great work. I'm proud of the legislature and proud of all those that are putting in the licks and everything. This will really, really, really help us and everything. The fund will be managed by the West Virginia Water Development Authority, and they will work directly with the West Virginia, or they will work together with the West Virginia Infrastructure and Jobs Development Council and the West Virginia Department of Economic Development to approve these grants as they come in. So these are matching dollars, you know, that we're matching with federal dollars, making our dollars go a whole lot further and everything. It's just good stuff. So that's all I got right now. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. As the governor said, that there is continued good news in many ways for West Virginia. We still are below 100 West Virginians hospitalized with COVID-19. And although it is a tragedy that a single person has died since the last press brief, that is also an improvement from what we have seen before. It is, however, still important to note that the BA.2 variant of COVID-19, the Omicron BA.2 variant, is highly contagious, and particularly for elder West Virginians, still should be seen as a risk to your health. In a study that was just reported, about 920,000 Americans who have died of COVID-19 have been over 50 years old, and that's what we've reported in West Virginia as well, which means about 1 out of every 125 Americans over 50 years old has died of COVID-19. And that's the reason why it's so important for those who are listening, watching, or who are connected through these this information press brief. decide to stay completely up to date with your vaccines, and if you are eligible for a first booster dose, please get that. If you're eligible for a second booster dose, please get that. We also know that the booster doses have been very, very important during the Omicron pandemic. And it has also been demonstrated that the Omicron virus, because of the number of changes, is a little bit less affected by immune responses to COVID that were generated against the Delta variant or the Alpha variant. So this is even more reason for people to get vaccinated. The last thing I'll say is in a new study that came out in a scientific journal, The Lancet, looking at over 2,000 people who were hospitalized with COVID, the investigators found that 1 in 4 people had persistent symptoms at 5 months and also at 1 year. And the risk factors for people who had persistent symptoms in this study turned out to be the severity of illness in the hospital, but also being female, being obese, and having inflammation as measured by some laboratory tests during the hospitalization. So the long COVID impact for people who have been hospitalized is still very significant. And that's another reason why we ask people not only to get your full vaccinations and be up to date with those. And again, the vaccine calculator can help you, but also to be very cognizant, particularly if you're in the older category of people or you have an immunosuppression issue, you're immunocompromised in some ways, then still consider protecting yourself by wearing a mask, a high quality mask if you're going to be indoors around other people, and just to be generally careful. Thank you so much.
All right, thank you, Dr. Marsh. Retired Major General Jim Hoyer, the director of our Joint Interagency Task Force, Secretary Bill Crouch, Dr. Ayn Amjad are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel and fellow journalists. Governor, and probably this goes to General Hoyer, Associated Press reporting that a number of vaccines are about to go out of date and may go bad here before long. We had this question a while back, and CDC, I think, extended the lifespan of those vaccines. Where does West Virginia stand on that situation?
General, please.
Yes, sir, Governor. So, Paul, we still have some Pfizer vaccines that we have held in supply that we're waiting to hear back on whether those would officially expire or not. But what we have done from the Interagency Task Force standpoint is to manage pretty effectively the numbers. So we maintain a much smaller supply in our hub system, which is down to one hub site location. And then most of the other vaccines that are available across the state are through our pharmacies across the state. And to date, I have not heard any specific information that they are having any expiration of large numbers of vaccines. So right now, we tend to be trending in a pretty positive place as far as managing those expectations.
All right, thank you, Paul. Next, we'll hear from Jess Mancini with Ogden Newspapers.
All right, thank you very much. I guess my question is for Dr. Marsh. The active cases have been slowly increasing, I think, for the past 6 weeks. I know they're still below 650, but is that how worrisome is that for you fellows?
Okay, Dr. Marsh, please.
Thank you, Governor, and thank you, Jess. We know that this variant of COVID-19, the Omicron variant, is one of the most highly infectious viruses that we've ever seen. So we do understand that that we will see spread of the virus as the virus becomes more dominant here. And so the cases going up are not a surprise. What we also know, though, Jess, is that the real delineator of our success as a state, as a leadership group, will be looking at the severity of illness, particularly hospitalizations, ICU admissions, and death in people who have been fully vaccinated for this, and particularly in our older population and our immunocompromised population. So as we talk about the vaccine numbers and looking at who is staying up to date, particularly as we said, the older part of our population or the more immunocompromised, the people that are at higher risk of not being able to mount a sufficient immune response, those are people that we're particularly worried about and watching here. We also know that the vaccines don't necessarily keep people from getting infected, given the incredible infectivity of the Omicron BA2 variant, which is like the measles, as we've talked about before. But these vaccines, particularly the second booster shot for people who are eligible, who are over 50 years old, has been shown in Israel to reduce deaths by 78% and reduce hospitalizations by 65%. So getting our really most vulnerable population treated is going to be an important metric for our success that we will be tracking closely as well.
Great, thanks, Jess. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I know that you didn't include a replacement bill for House Bill 4001 that you vetoed earlier on your call, and you said that would be addressed in a future call. Does that mean there are already concrete plans for another special session in the future, and are there other things that you are already thinking about including on that future call? Thank you.
Well, Charles, we're going through so much big stuff and everything. From the standpoint of broadband, I think everybody is lockstep as far as what we need to do, and that we're all advocates and we're all for. But absolutely, without any question, we'll be back in another special session, and we'll be back there. We'll be back there soon. There's not any concrete plans at this point in time put forward and everything, but we'll keep you posted, and really and truly, we're going to have to do some cleanup on the broadband bill and everything, and get it back in front of the folks in the legislature, real soon.
All right, thanks, Charles. Governor, I'll turn it back to you.
Let me think. Well, again, it's hard to feel congratulatory, to all the folks that are putting in all the licks, when we're really celebrating only seeing one death. And so we don't want to feel any feeling of congratulatory, at this point in time. We've still got a long ways to go, and losing one person is not good. It's just plain not good. I would tell everyone to enjoy your life and live your life to the fullest. Enjoy your children, and absolutely with all in us, we have got to get back to as much normalcy as we possibly can. At the same time, we still want to be smart. We still want to pull the rope together, help each other every day we possibly can, continue to do more and more good things for our state and everything. We've got it rolling now. We want to just keep it rolling and keep it rolling in a really positive way. And so, the only other thing I'd add is just this: is I'm a lover of our outdoors. I'm a lover of absolutely nature in every way. I've always been a hunter and fisherman and everything. And so this morning I was able, we had a few hours, and I was able to get out and go turkey hunting this morning. And I've got a little picture here right here for you. But, I don't know which is bigger, but the turkey makes me